Good morning. Welcome and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. We've been dealing with COVID-19 every day for nearly 2 years. The good thing is we learn. We learned what to do and what not to do. We learned to work with other people, many times in new ways. Today, our panel includes frontline managers from several different businesses. They'll share their learning with all of us. Today, our topics include the latest on COVID-19 and a roundtable discussion sharing the learning at the front line. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Darren Lord, a convenience store operations director with R.H. Foster. Jake Knight, a branch manager at Bangor Savings Bank. Chris Laird, a nurse and Associate Vice President of Patient Care Service at Northern Light Eastern Maine Medical Center. Jesse Higgins, a psychiatric nurse practitioner and Director of Integrated Behavioral Health at Northern Light Acadia Hospital. Dr. Jim Jarvis, Director of Clinical Education at Northern Light Eastern Maine Medical Center and Physician Leader of COVID-19 Incident Command at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation, and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with the latest on COVID-19. Dr. Jarvis?
Thank you, Ed. I'm going to try to keep this brief because I'm really excited about our panelists today, and I'd like to spend as much time there. I do want to show this graphic here that really kind of shows the pandemic really from the beginning all the way to the current time in a nice graphic format. And if we just look at hospitalized patients, we can kind of see that initially during the pandemic, we had those low but several peaks there. And that was when we were focused in on slowing the curve or flattening the curve. And then we had that dramatic peak, which really was about a little over a year ago. So when we started to see some relaxation of travel restrictions, we saw some relaxation of some requirements in different communities, and we saw people traveling for the holidays. And we know what that caused for us. But then we saw a rapid decline. We had a very nice spring and early summer. But then we see that almost the second to last peak there. And that was when the Delta variant came, a change in this virus that caused us to have to rethink our strategies because the virus was more infectious and more virulent. And then we see the following peak, which we never really had a valley from, and that was the Omicron variant, which was far more infectious than even the Delta variant, which in and of itself was more infectious than prior variants. But the good news is looking at the tail end of those hospitalized numbers and even the tail end of deaths, we're seeing those come down in the United States, and that is welcome news for us. But still notice that line, even at the end of the graph, is still significantly higher than what we saw in peaks earlier on in this pandemic. Next slide, please. And what's the difference between the United States and the rest of the world? Currently, we hear a lot of people saying, hey, look, Denmark's doing this, or the United Kingdom is doing that. How come the United States can't do those things? Well, because we're in a different situation here in the US than most of the rest of the developed world, and in fact, even some other places that are less developed around the world. When we look at cumulative deaths per capita, Not only is the United States has the highest mortality rate from COVID-19, it is significantly higher than just about every other industrialized nation in the world. And that's amazing that we can be that far off. And a lot of that has to do with the way that we initially approached this pandemic, and then what has happened subsequently from that, not the least of which is if we look at the share of the population who have already received a booster dose, so not just their primary series. Again, the United States lags behind most industrialized nations in that, and that we really haven't taken the right precautions to do the things that we see in other countries who are now relaxing their COVID mandates in a much more faster fashion than we are here in the United States. Next slide, please. So where are we at in the US? Well, while it's encouraging that our case counts are coming down, the CDC's most recent report says that 99% of all counties in the United States continue to have high rates of spread in communities. And all 100% of counties in the state of Maine continue to be in that category, despite the fact that we are seeing some much welcomed reprieve. Next slide, please. So what are things that we can do? Well, the things that we've talked about are still the same strategies. There's been a lot of talk about masking of late, particularly as certain cities and states and countries are relaxing mask mandates. And a lot of controversy about whether masks do good or not. I think this graphic really shows that having no mask is definitely not the way to go when you are in an area of high transmission, particularly that people who are indoors. If we look at this graph, even a cloth mask, which since the beginning we have said does not provide the best protection, it still reduces your rate of infection by more than 50%. If there were other things in our lives that we knew that if we just did would prevent heart attack or other severe health conditions by 50%, we would try to take those measures as much as we could. Certainly, if you have the ability to obtain surgical or procedural masks, or those N95 or KN95 respirator masks, you can see that the spread of the disease is even much more lessened. And so trying to use those, but even a cloth mask provides protection, and it's way better than no protection at all. Next slide, please. So there was a recent poll out about people getting boosted. So we've talked for a long time about people getting their primary series for vaccination. And we know that while many people, particularly here in the state of Maine, nearly 80% of eligible individuals have completed their primary series. And we should all be very grateful that that has happened and proud that that has happened in our state. Booster shots are also necessary, particularly because of the fact that the Omicron variant is so much more transmissible than we saw before. And as you can see, of the people who have had their primary series, almost 40% said that they will get boosted as soon as they can, but we still have almost 20% who said they were not going to get that booster shot. And that means that we're just going to have that much more of a population that is vulnerable to disease and to spread to disease, even at those who have been fully vaccinated or received their booster shot. So next slide, please. But there is some good news on the horizon. The very high case counts and hospitalizations that we have seen now for the last 2.5 months are decreasing. I always put a caveat to that. They are still higher than most of where we were during the pandemic, but it is excellent news that we are seeing that happen. And particularly over the last 2 weeks, we've seen a much more dramatic decrease in both case counts and hospitalizations, but they are still quite high. Treatments for mild to moderate COVID-19 are scarce, but they are more readily available today than they have been. And so I encourage you to reach out to your family members, coworkers, and community members who are at risk for severe disease, that if they do have a positive test for COVID-19, that they reach out to their primary care provider or go to Northern Light's website to schedule or to have evaluated whether or not they qualify for treatments for that. And you can see this category here. And the last good news is that we expect by the end of this month that we will have the vaccine available for children ages 6 months to 5 years, meaning that almost everybody will have a vaccine available to them in the United States. And like I said, that could come as soon as this month. Northern Light Health is working with the state of Maine in preparation for this news, and we will be able to administer the vaccine as soon as it becomes available to us after it receives emergency use authorization from the FDA. I will remind everybody that for anybody under the age of 18, it is still the Pfizer vaccine that is the only one available for that age category. Again, here's our website that you can go to that will talk about not only vaccine availability, but also the availability of other treatments and other options, and gives great information about COVID-19. Next slide. I think that might be my last one. I'll turn it back over to Ed.
Well, thanks, Jim. I have a couple of clinical questions. Just to clarify that 6 months to 5 years, if I recall correctly, 5 years and above currently are eligible for vaccinations, correct?
That is correct. So right now the categories are 5 to 12, 12 to 16, and then above 16. And so each one of them has some special considerations for it, usually around the amount of the dose or the amount of vaccine actually administered. And the amount of vaccine that'll be administered to those that are 6 months to 5 years of age is actually 1/10 of what is given to adults. Still remains to be seen as to how many doses and what the dosing schedule will be for that, but we, again, expect that shortly.
Excellent, thank you. So we're hearing about a BA.2 Omicron subvariant. You know, actually some of the reading I've done is that it's warranted to actually call it a different Greek letter even. Yeah, tell us your perspective on this BA.2 Omicron and how concerned we should be about it.
Yeah, that's a great question, Ed. So from a clinical standpoint, we haven't seen significant changes between that variant of Omicron and the original variant of Omicron, which of course is a variant in and of itself. And so it still remains for us to be watchful and careful about it. I think the reason why there's been discussion of should it have just been given its own category and not being called a subvariant of Omicron was because of some of the way it works in a laboratory, and also because it's quickly becoming a predominant variant or subvariant in other nations. We haven't seen that same dramatic effect here in the US, and certainly not here in the Northeast. But as we know, we usually lag behind everybody else, and so we'll probably be seeing that. But from a clinical standpoint, our vaccines are still protective against it. The treatment options that we have for both people with severe disease and those with mild to moderate disease who have a high risk for severe disease work against that particular subvariant. So that is good news for all of us.
Okay, well, thanks for that info. One more. We're starting to hear the boosters are good for 4 months. Also, we're hearing about Omicron-specific boosters from Pfizer and Moderna. What's your take on all of this?
Yeah, so first and foremost, we do know that boosters are lasting as long as that. And many of us, particularly those in healthcare who were the first ones to initially get vaccinated and then to have booster shots offered to us, that protection continues. And that's good news, mostly because we haven't had yet another major change in the strain that's out there. And so that's good news. As far as an Omicron-specific vaccine, it doesn't appear right now that is necessary because the original vaccine, and remember the booster shot is still that original vaccine, and it doesn't matter which of the two, Moderna or Pfizer, that people receive for their booster shot, continues to be effective. But the good news about the science behind that is if they can create one specific to Omicron, they can be prepared to create one for the next variant that may evade the current vaccination status we have.
And talking about effectiveness, that's always been a confusing issue. So we're talking about effectiveness against severe illness, hospitalization versus infections.
Yeah, and again, that does become confusing. Obviously, the thing we want to prevent the most is death. The next most important thing to prevent is hospitalization and then infection itself. What we know is that the vaccines work against all three of those, much better or much more efficient at preventing death, then hospitalizations, and last infections. But again, as I talked about with masking, if you could get a 50% decrease in your chance of having severe illness or catching a particular infection, that's great news. When we're talking about these vaccines, we're still talking about numbers way greater than 50%. In some studies, 85%. Some studies, 80. Even higher than that. And so all of that is welcome news. Vaccines work.
So thank you so much, Jim. So I'm going to ask you to hang on to your clinical hat, and I'll pepper you with questions as they come up. And then also wear your managerial hat, because you've done a lot with managing programs and people along the way. So at this point, we'll now move into our roundtable discussion with our panelists all joining on video. Panelists? come join us. Okay. So what we're going to do, panelists, I'll ask you to introduce yourself, then do not pass go. Go directly to the bottom line. What's one important thing you learned about people managing through the pandemic? And we'll start with Darren Lord.
Thank you. Thank you for the opportunity to join the panel discussion today. My name is Darren. I'm the Director of Retail and Convenience at RH Foster. Been in retail and management of people for many years. Do have a degree from the University of Maine in economics and math. So I don't know how applicable that one is to COVID, but it's managing people is always an experience. I think the big change for us was really embracing our frontline associates and embracing our guests and really managing through that process and really giving the skill sets and teaching our associates how to de-escalate situations as they would present themselves as they're on that front line of engagement with customers, and really arming them with the tools to be successful, during these changes that they were presented with.
Mm-hmm. Well, thanks, Darren. Jake Knight, please introduce yourself and share with us something you've learned about people managing through the pandemic.
Thank you very much. Really appreciate it. My name is Jake Knight. I'm a branch manager at Bangor Savings Bank. I'm currently at our Brewer location, and I've been with Bangor Savings for a little over 3 years now. And I would say with managing people through the pandemic, my big takeaway as working as a frontline worker, the importance of teamwork and compassion. With all the uncertainty surrounding the pandemic, it's truly reinforced the importance of that teamwork. I mean, there have been multiple times that we've had to pivot to cover other branches, find new ways to support each other in order to continue to provide the service that our customers have grown to expect. So compassion and teamwork.
We're already starting a theme, it sounds like. Well, thank you. Chris Laird, if you would introduce yourself and share with us what you've learned about people during all this.
Good morning, and thank you so much for the opportunity to be here. My name is Chris Laird. I'm AVP for Patient Care Services here at Eastern Maine Medical Center. I've been in this role about 8 months. One of the big things that I've seen through the pandemic and how we work with people, I would have to agree that teamwork, the compassion, but also the importance of being nimble and being able to kind of switch on a dime. And as we work with people, how to kind of manage that and how we kind of role model that for staff and to kind of help them understand where we're coming from and how we communicate with staff. So I think it's everyone truly needs a different style of communication, and it's trying to meet everyone where they're at and trying to be able to kind of share some of that information and what we're doing on a daily basis.
So that really builds on the compassion, empathy, being flexible, targeting the needs of the individuals. That's awesome. Thanks, Chris. Jesse Higgins.
Good morning. I'm Jessie Higgins. I'm a psychiatric nurse practitioner and also the director of integrated behavioral health. So we have clinical social workers and psychiatric nurse practitioners integrated into medical clinics all across the state of Maine. We're a virtual team. We were a virtually led team prior to the pandemic. So Zoom was old school for most of us when it was just getting popular. I think in addition to the values that other folks have talked about, and I really do think that that is central here. I think one of the lessons that we've learned is that living our values in business and in healthcare is really what people are looking for. That's of primary import. That's what carries us through good times and bad. So in addition to the compassion and empathy and teamwork other folks have mentioned, I think the other values that we really rely on is living accountability, integrity, respect, really being authentic, and the leaders that work with me that lead frontline employees, ensuring that we all understand that our job is to support our employees, make sure they feel safe, make sure they're heard, make sure they know what's coming before it comes, and have an opportunity to lift their voices as frontline employees. As long as we're doing that, these other pieces, the finance, the customer service, patient satisfaction, those things seem to fall just very neatly into place, as long as frontline employees feel engaged and seen and heard.
So that I take away from that two levels, both of which is like living your values as a company, living your values with your customers as well as with your staff employees. Yeah, great, thanks. So Jim Jarvis, you don't need to reintroduce yourself. I think you're pretty well known at this point, but please weigh in by telling us a little bit about your experience with the mass vaccination sites and what you've learned about people.
Yeah, I think overall, one thing that you learn when you do something like that, where you have, 100 or more staff working on one particular goal, serving as many as 3,000 people in a single day, is that everybody wants to do something good and be helpful. And I think it's reaching out to your individuals and encouraging that kind of behavior. What I used to say at the mass clinic in Bangor every day was to start off by just saying, smile. I know we're all wearing masks, but starting your day off with a smile and that your end goal is to save lives has a huge impact. And it doesn't have to be something as dramatic as saving lives. I mean, it could be whatever it is that is the goal for you for that particular day. But starting off in a place that's positive always seemed to help us, even when things went wrong. And while we were very successful at that particular location, we did have things that happened from time to time. We had a power outage once. We had some computer glitches and things like that. But remaining positive is really what you need to do. And from my standpoint, it was trying to always come across with that positivity and a big smile. And especially when wearing masks, you have to have a big smile so that everybody can see it beneath that mask.
Excellent. Okay, everybody put their smiles on. So I'm going to ask you some questions about challenges at this point. And the way I've framed it is thinking about challenges at the beginning of the pandemic. So there was an overwhelming amount of unknowns then. And then we'll fast forward and think about the more contemporary challenges, as things continue on, but we've learned a lot, but we don't know it all. So Darren, I'm going to start off with you on this one. What were your most difficult challenges at the start of pandemic? And if you can, give some examples, but don't use any identifying information on individuals.
Okay, will do. So I think one of the biggest challenges was really winning the hearts and minds of our frontline associates. On many of them have been ingrained in their societal views and really embracing the CDC guidelines and city main guidelines on vaccination and mask mandates. And many of them, when we had the mask mandates for associates coming in, or guests coming into our stores too, and enforcing those was a challenge. It really was, because they were directly on the front line and really coaching through that and de-escalating opportunities and situations, because we truly wanted to elevate our experience for our guests that have come in. One of the things that for us that we take pride in is many of our stores and are really community centers in the towns that we service. And it's a high level of engagement that the customer comes in and has that experience. Many of our guests come in 3 to 4 times a day. It's what they do. And they know everybody by name, and really being able to connect with them. And then now we've got masks on, and then many of them wanted to, I guess the second part of your question was, we had to learn our business model and pivot quickly as people required contactless payment and online ordering, something that we had never embraced and done. So as a team was really just starting from that organic ground up and building a new business model to really meet our customers' needs. It was a big change for us and a big challenge. I mean, for us and our company, people embraced it. They welcomed the challenge, and some of the same things that Jessie had mentioned as far as being authentic, I couldn't agree with her anymore, is people will see through falsehood. And if you don't have that true compassion, it's not who you are. people see through it. And it was really meeting people's needs and being authentic at that point of contact for us was critical.
So Darren, in your business, it seems to me that you wouldn't have much opportunity for remote working for your staff, correct?
Correct. Outside of key management positions, the marketing team, some of the category management, and so from the frontline associates, so probably 90-95% of the jobs you're going to be on the front line of engagement. But it was a big change for us because we're used to meeting everybody in person, even our store managers during our staff meetings, and we're used to that. And for us to really remove that and we didn't do Zoom, but we did Teams, and to be able to share information with a new platform and really embracing that technology piece. And again, that's a training opportunity. People that were not really techie savvy, and really training them and getting them up to speed on these new platforms. It was a big change for us.
Yeah, great. Okay, well that's helpful in terms of some of the questions I have down the road here. I have one more to understand your business just a little bit more. During that, first year in particular, I'm envisioning that your customers who were there up to 3 times a day weren't coming in at the regularity that they had previously. And was that changing your business at that point? And what did you have to do to keep things afloat? And then also, did you have to close any of your locations during that time?
We did. We did. And one of the things that Jake had mentioned, which he absolutely nailed it, was being able to move resources at a moment's notice, because we did unfortunately have situations where we had COVID outbreaks, which would affect numerous employees, and so we did have to shut down stores and go through all the proper protocols of cleanings. And we take our guest experience very, very serious. That when they come into our store, we want them to ensure that proper cleaning is taking place. We've taken all the social distancing very, very serious, and we want them to have an elevated experience. Most importantly, a safe experience. Also for our associates, we want everyone to be able to go home every night, hopefully better than they came to work, with a smile. They've had a great experience. So for us, it was a big change for us as those customers come in. But again, their requirements for us were different. They wanted to ensure that we were practicing social distancing, that we call it looping, where we require cleaning of high touch points every 30 minutes. And we were following that protocol. For us, was making sure that we were enforcing those procedures at our sites.
Awesome.
And so I would say this, I think the last thing I would say is that though revenue was important in the business model, it wasn't what we came to work to do. It was a secondary motivation. Our main motivation was, how do we ensure our guests are safe and our associates are safe? The rest of it, I think Jesse mentioned this. If you do that, the rest of it takes care of itself.
Yeah. So that's another part of our evolving theme here this morning, like safety of customers, safety of staff through it all. Okay, very helpful, Darren. Yep. Jake, I'm going to do a little twist on this for you, also about challenges. So now let's kind of fast forward after vaccinations are available, and we're sort of into the springtime of last year, where we felt like we had some real light at the end of the tunnel, but you were having to adjust throughout that whole time into like last summer when Delta showed up, right? Tell us a bit about the challenges that you saw at that time.
Certainly. I can tell you as the vaccinations were coming out, there still was no lack of challenges for sure. We were dealing with a lot of challenges related to employees, for one. We recognize that employees, they're juggling pandemic impact. There's a family exposure. They could be out of school. Their kids could be out of daycare. We had to adjust to adapt and create the opportunity for them to take care of their family first. So we had to adjust and pick up the slack for everybody. So with our customers, we essentially pivoted from serving our customers in person to virtual wherever possible. There were a lot of customers that with the unknown, weren't interested in meeting in person. So we quickly switched to Zoom meetings, which really allowed us to stay in contact with our customers that we couldn't see on a daily basis face to face. And along that same line, our technology, we basically fast tracked our technology forward into Zoom meetings, even adopted an online appointment scheduling tool on our bangor.com. But along with that, we had to learn how to use the technology and also go forward and teach our customers that new technology and how to use it and how to utilize it. So, and then finally, Bangor Savings Bank traditionally, I mean, we're very ingrained in the community, a lot of volunteerism, but traditional events were canceled, postponed, or they were pivoted to virtual or hybrid events. So that'll kept us with limited engagement opportunities. And in light of the pandemic landscape, we had to learn to support in more of a virtual environment, especially where a number of our employees are on boards, local boards. But, it really affected the way that we traditionally connect with the community.
So it sounds like, once again, flexibility is an important part of what you were doing in what you were explaining to us, technology and adapting to it, teaching people, making it available. Let's just talk briefly about bureaucracy. So, pre-pandemic, we all had our way of doing business and the committees we have to go through and the policies we have to be aligned with. Did you find that the bureaucracy was less during the decision-making in the challenges of the pandemic?
More focused on taking care of employees and keeping people safe as far as our customers. Mm-hmm. Basically, we had a shift towards how can we continue to provide that customer service that our customers have grown to know and expect in a safe environment for them, whatever that may be. Now, I know I mentioned shifting a lot of technology to virtual meetings, especially when we had to close our doors. But again, when we reopened the doors, it was amazing to see how many people were back into our branches. It's really that relationship banking that people are striving for, and they want that interpersonal connection with us. So.
Okay, well, thanks.
Dr. Gilkey, I just want to respond, if I can, to something Jake said, because just really to underscore, because I think it's so spot on, that the importance of connectedness, especially in the beginning when there was so much emphasis on distancing. I saw really early on an article that differentiated between social distancing and physical distancing, because social connectedness really had to be our priority to survive. We had to find a way, as Jake said, to find our way back to each other, to stay connected, to support each other while staying safe. So we really pivoted away from that social distancing language early on and talked about physical distancing and social connectedness, and really made an agreement amongst our team, not just the management, but direct line folks, that if you need something, and we work in psychiatry and mental health, so the people in your household aren't necessarily always the best people to debrief with at the end of a challenging day. So we needed to make sure we were there for one another, whether it was a text message, a phone call. If one of your colleagues calls you, are you going to take that call? We increased our rounding, so I would just hold space so that folks could drop into a Zoom meeting several times a week and just to touch base with one another. People often did, and they would say things like, I don't think I'm cut out for this anymore. I don't know if I'm good at this anymore. I thought I was really good at this job, but now I don't know. And then everyone was saying that. So we started to talk about what that means and what the struggle is and how we could provide support. And I think that not losing touch in the way that Jake's talking about, that remaining a cohesive unit, even when you have to be physically distant, I think that probably was the thing that helped us the most.
That's awesome. That's really an important part of it all. So I'm gonna switch out thinking a little bit about, in all of this learning, we may be able to apply this to how we do business going forward. Think about what the people have taught us and how we're applying that to our business. So Chris, I have actually two questions and I'll ask them in order. If you could give yourself a piece of advice in February 2020, what advice would you give yourself to help get you through the pandemic? So this is a hindsight question.
I think in hindsight, for myself as well as many of the staff that work for me, I think one of the biggest pieces of advice that I could give myself would be to truly make time for yourself. Self-care, I think, is something that has been found through the entire pandemic. That's something that's very important. I think being able to care for oneself is truly pivotal to being able to, especially in healthcare, being able to care for others. And you have to be able to come in with the right mindset. You have to be able to be there and in the moment and physically present. And I think being able to, one, give yourself the ability to say, it's okay to take a day off. It's okay to take time to care for yourself. But also in that, being able to connect with your loved ones and your family and the family that what's important to me on a daily basis. I think that is something that I would truly say would be kind of in hindsight, something to say, it is okay to do this. We're trying to ensure that we have that responsibility to be present and to be here to be able to care for patients and do what we need to do on a daily basis. But I think giving that, it is okay to take a day off and to make sure that you care for yourself.
Mm-hmm. So self-care is a really important part of that. So the second question is, fast forward to February 2022, and what advice would you give yourself and others today? And I'm thinking about that in the context of the various moving parts that we have to deal with. There's a lot of our world that's saying this pandemic is history, yet you amongst all of us are really seeing that this is far from over.
I think today, while self-care is still hugely important, I think the other pieces that are important are to be kind, to kind of know that everybody is out there going through some struggles of their own. So to kind of realize what everybody is going through and to be kind. I think that's truly important. I think the other aspect in looking at it is to know that as we go through and we identify all of these challenges, I think Jake has said it, I think Jesse said it, that being able to be nimble and to kind of address issues that come up and be okay to say, that's what we did yesterday, but today this is what we're going to do. So being in that mindset to say it's okay to change what we're doing. It can't be that this is the way that I've done it and this is the way that I always will do it. We have to embrace that nimbility and that flexibility to say it's okay to change how we're doing stuff on a daily basis.
Yeah, thanks. So Jim, you and I have experienced a rather large health system, and we've observed our colleagues in other health systems. And I think large systems generally lumber along making decisions. Yet we found that we were incredibly fleet of foot, and I would say we're certainly still fleet of foot. We're making decisions every day and adjusting along the way. So in terms of, let's say now the pandemic becomes the endemic, and we're not spending all the time we are today on it. What do you see going forward in our system, other systems, and probably in a general way for businesses? What's lessons learned about making decisions?
Yeah, that's a great question, Ed. I famously, in the very beginning of the pandemic, when I was first asked to be the clinical lead for our response, came home after a meeting and said, "Oh my God, it's clear none of these people are in the military." And my wife said, "And neither are you anymore," because I wanted command and control. I wanted, let's make a decision and let's go for it. And that's not the way big companies work. But we did become nimble. We did find ways that we could improve upon that. And even now, we have stepped back from certainly that command and control kind of philosophy because it's not needed. We're not in that crisis mode anymore. We've learned so much and learned how to deal with it. But one thing I do continue to see is that we are so much more collaborative than we've ever been before. So, we're a big company. We own 10 hospitals. We own countless numbers of ambulatory practices. And thousands upon thousands of employees, is the second largest employer in the state. And yet we still look to each other and say, how are you doing this? How did this work for you? What is it that we've asked of you that didn't work and you need help with? And I'm hopeful that continues. And then we look at the state of Maine and how well we have done the same thing. We look at Maine Health and Northern Light Health, and for decades, they were certainly competitors and looked at each other, sometimes in a very adversarial role. I speak to my counterparts at Maine Health several times a week. Sometimes I talk to them more than I talk to leadership at Northern Light Health, simply because we're working on a similar project or something to facilitate helping Mainers get together. And I am so hopeful that that will be what continues, that, in Maine, there are no public hospitals. All of them are private institutions in some fashion or another. And yet we have worked so well with the state of Maine and each other to continue to help Mainers in every way that we can. And we see those successes just play out in some of the numbers that we've seen. Maine has one of the lowest mortality rates from this disease. We have one of the highest vaccination rates from this disease. And in some ways, we led the nation in ways that we mitigated the disease in the beginning of the pandemic and then reopened our economy in a safe and healthy fashion. That's what my hope is that we will continue to drive that. And we've seen it in other things, that we are now much more collaborative in research, in education, and in care. And that's only to the benefit of Maine.
It sounds like perhaps we've changed for the better.
I hope so. Never,
well, I suspect,
never, ever, not utilize a crisis to improve.
Yeah, I suspect you, as well as myself and others, will always be around to remind. Look what we've learned here. Jake, if you would go down that path too, what did you guys learn at Bangor Savings that you're applying? I heard a lot about, safety of your employees, safety of staff. That might be a good place to begin. But what did you learn about doing business that you think you're going to incorporate going forward and keep with?
I think one of the major things that we learned going through this was that there are multiple ways to connect with customers. There are multiple ways to connect with other employees within the bank, and it's so important to stay connected in some way in order to create those lasting relationships. I think it's important to remember that flexibility is key moving forward. I think from everything that we've had to do internally to protect our employees, protect our customers, it's only made us stronger moving forward. I think, you could just about throw just about anything at any of our employees today and they would be able to handle it. So I just think that perseverance and working together moving forward is just key to our success.
You remind me that many of the qualities or attributes we consider in ourselves and others, we don't really know if they exist until they're tested. And I think resiliency is one of those examples. It's remarkable how resilient collectively we all are in all phases of our lives to get through all of this. Yes, there's lots of challenges, and yes, there's a lot of people who are struggling, and we're in positions to help them, so we do. But it is remarkable seeing people around you and yourself what you are capable of. So thanks for that, Jake. Darren, I'm going to stick with this theme just a little bit longer here, and I'm really interested in seeing what have you guys done to adjust your business going forward? Those positive lessons learned.
I think the one thing or a couple things that have been key learnings for us is that a business strategy and a business model that was successful in years ago and even last year, even pre-pandemic, doesn't necessarily mean that you're going to meet the customer's needs going forward. And I think one of the things that Dr. Jarvis had talked about was change is inevitable. and embracing that change and really, I think your best leaders are the ones who take these things head on, be authentic, and learn from them. And us as an organization have really taken that head on. How do we change? And I guess the key learning is even the things that we're doing today will continue to change. And I think the big thing for us is meeting those customers in these different day parts that are just different from how we used to do it in the past. The big change for us will be contactless interactions with our customers, online ordering, delivering, people expecting curbside pickup. You've seen even a lot of the big box stores have embraced that. And for us, having those type of resources and embracing that, it's a big change for us.
Yeah, let's just talk about change just a little bit more, Darren. By the time you're at a director level in a company, you've had some formal training in change management. And, while we're going through it, we're trying to assimilate it and say, okay, this is what. Have you seen yourself having to apply those things that, let's say, you learned in the seminars, conferences, and books?
It's funny. It's I'm not one to not miss a good opportunity to wax nostalgic. We're going into Super Bowl weekend and we're finding, Tom Brady's leaving and, he's retiring. And you look back at the proverbial good old days. But as much as we like to do that, it is about change. And it's really the world is changing. Either we can change with it and embrace technology and embrace science, or you just get left behind. And it's really helping. And I truly believe, I think it was Jesse that was mentioning, I truly believe everyone comes to work every day with a good heart and they want to do the right thing. And my job is, how do I become the best coach and the best servant to them to help them along the journey? And that's truly what motivates me every day when I come to work. How do I become the best servant leader to them I can possibly be? Mm-hmm. Now, my wife may disagree. I think she'd probably say she wished I did it more at home, but I truly try to embrace it when I come to work.
Yeah, that's awesome.
I think there's still some dishes and some clean floors she'd like me to do, but I'm doing my best.
Well, perhaps there's a difference between servant and servant leadership.
Exactly.
So Jesse, this question's for you, and it's kind of, we could frame it as a clinical question, but I'm going to tap into your behavioral health background on this one. After all of the successes, how does one speak to coworkers and colleagues who still won't get vaccinated because they don't trust the science? And trying to look at it from like, well, I don't believe any of that. How do you handle that kind of stuff?
So it's interesting because I think partly from a clinical standpoint, as direct care folks, we've heard from members of our team, from therapists, that for the first time in their career, they've had patients come in and demand to know how they vote before they want to pursue therapy with them. I don't trust you to be my therapist if you belong to this political party or this political party. That's how divisive things are. So I think one of the things we didn't really touch on too much in this conversation so far is the social and political divisiveness that's gone on during this pandemic and how painful that's been. When I think always it comes back to shared humanity. There is really no phrase that is closer to my heart than that one. This pandemic has made it so real that we are all in this together. And I think the fear has left people grappling to find a tribe and to find a side. And things like whether or not you get vaccinated become like a core part of your belief system. So if you approach that conversation in a way that, in a really direct way, like a why not, people often feel like that's an attack on their identity because they are so rooted in that, that's such an integral part of how they see themselves and keeping their families safe. It feels like a threat. So I approach those conversations with employees as well as with patients and family members from I am never telling anyone what to do. I will share some information, but for the most part, people have the information. It's just about exploring with them, giving them a safe space to talk through their fear. Underneath that combativeness and resistance is really anxiety. I think most people we talk about, I loved Chris's, message about being kind. I think there is nothing more important than we can do than be kind. There was I'll misquote it, but there was a Robin Williams quote that he said something like, everybody is walking around with dealing with something you know nothing about, so be kind. And that is really true. So I think just being a person who is a safe place for people to process with is incredibly healing. And when we had conversations recently with employees about boosters, there were some people that were like, well, I'm already in compliance with the policy. I don't, why should I get a booster? And I said, well, I can share some clinical information with you, or we can just talk about, what your concerns are. And that's just being supportive, I think, and open. I don't think you're going to make anybody do anything. Nobody can make anybody do anything, but we can dial down our rhetoric, dial way back on the judgment and on the divisiveness and on the digging in our heels, and recognize our own implicit bias in these conversations that, and just create this neutral space to be people with other people. And I have said to people, I'm a person. People get mad and they'll start yelling, and you'd be like, I'm a person just like you are. I have feelings and I'm trying to be here for you. So maybe we could just be in this space together and have a conversation. And people usually are like, oh, was I yelling? I'm sorry. I didn't mean to be yelling at you. So I think that's it. I mean, it's really about, we are far more the same than we are different. Our anxieties come from largely the same place. We want to be safe. We want to keep our families safe, our communities safe. Assume that people have good intentions, listen to them, and hopefully in the end, people will make good decisions.
So, Ed, I've got a quick comment on that.
Yeah, please, Darren.
So, during one of the heights of some of the controversial stuff, so I had a fun hashtag line that I was going with. It was called "Love the One You're With," and having some of the conversations with some of the associates that around vaccinations and masks and stuff, and you could see some of the reactions, and they'd be angry, and I'm like, you cannot like me, doesn't matter, I'm going to love you anyways, doesn't matter, we can disagree on things, I'm just going to love you, I'm going to love our differences, and I'm going to help you along the journey. So it was a fun hashtag. It really did serve its purpose. People had a lot of fun with it, and it served to de-escalate situations.
Excellent. Well, thanks, Angela. Jesse, it turns out that you paraphrased Robin Williams quite well. Everyone you meet is fighting a battle you know nothing about. Be kind, in all caps, always. So I think that feeds right into what Chris was advising us as well. So unfortunately, we have like an hour's worth of questions to go through here, but the time is short. So I'm going to ask our panelists all a final question, and be sensitive to about a minute and a half in terms of your response so that we can do our wrap-up piece as well. So here's the question. Let's see. What's one thing you want to make sure our audience takes away from today's session? I'll let you take a deep breath. And Jim Jarvis, why don't we start with you?
Yeah, thanks for that. What I heard is that we are all adaptable, and that we are all resilient in one way or another. And you just heard it. Again, I'm so happy to be doing these seminars and having such great people come on and just share their life experience. And I think if anything, just remember, we're all people, and that we can overcome anything if we put our minds to it and our hearts to it. And these people here are just living proof of that.
Thanks. Chris, one thing that you want to make sure our audience takes away?
Just one?
Yeah, just one. The list is long and glorious, I'm sure.
I think overall that we're not done yet. We're still going through this. Make sure that we continue to socially distance as we can, wash your hands, stay safe, because this isn't done yet. And as we've seen, this continues to mutate and continues to change on a ever continuing basis. So keep up the good work and stay safe.
So Chris, just to clarify, so you work with the nursing staff in ICU and other parts of the hospital, correct?
That's correct. Yes, sir.
Right. So you're really seeing the numbers that Dr. Jarvis shared with us in the beginning. The cases are still, pretty high relative to any time during the last 2 years, and you're seeing that wear and tear on the people you work with. Am I correct on that?
Yes, sir. We're seeing it on the staff, on the.
So the take-home message is: don't let down your guard. That physical distancing is still very important.
Absolutely.
Okay, great. Well, thanks for that. Darren.
I think Jesse quoted Robin Williams. I'll quote from a movie from Rocky. It's not how many times you get knocked down. It's how many times you get up. And with the I think I got that one right. And with the pandemic, it's definitely the goal line continuously gets moved, and it's how adaptable you can and how many times you can continuously get up off the canvas and just keep moving forward.
Awesome. Well, since you chose that from Rocky, I'll add it probably counts how quickly you get up as well.
Exactly.
So Jesse.
Yeah, I do want to bring us back to remembering that people are struggling right now. Pretty much universally, people are struggling. Our kids are struggling. We're all grieving. We're grieving the losses our children have had. We're grieving the lives we've lost during the pandemic. And change is important. It's important to embrace change, but it's also okay to stop and feel sad sometimes and reach out for help. As leaders, I think it's incredibly important that we create safe spaces for employees who need help with substance use, which we're seeing in epidemic levels in the state of Maine, with mental illness, with crippling anxiety and depression. We will get through this, but only if we are in it together. Only if we acknowledge that we too are struggling and that we need to support one another. I think there is something to be said for lateral support too. As a leader, don't forget that you also need support. You are also a person, and you need to make sure that not only are you practicing self-care, but we are practicing care for others, because really all of those things are going to work together, and that's I think how we get through.
Excellent. Well, thank you, Jesse. Jake, that 1 minute wrap up from you.
I think just about everybody's touched on this throughout this conversation, but I really think it's important to remember that, everybody is dealing with the effects of the pandemic in some capacity. And we should really work to lean on each other for support in order to work through the challenges that arise. And we will all be better for it. Now, whether those challenges are related to work or personal, just always remember to lead with heart and truly take care of those around you.
Wow, from all of you, I think I've walked away with the idea that we're all in different businesses to a large extent, or at least different parts of even the same business. And the walk away is all related to the people. Yeah, we've learned a lot. Well, we have included some tools for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists. I hope this hour of shared learning has been a help to support you, your employees, and our communities to safely manage through this pandemic. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session, which absolutely shouldn't be missed, will be on March 3rd. We'll be having an open discussion with the president and CEOs of Maine Health and Northern Light Health, two of the large healthcare systems supporting the people of Maine, joined by physician leaders from both organizations. They will share their insights on making rapid decisions under duress and leading complex organizations through uncharted and continuously changing environments where people's lives are on the line. Questions from our audience will be addressed throughout the discussion. A COVID-19 update will be provided at the beginning of the session. This will be another session packed full of learning moments for all of us. I really can't wait. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. Thank you and have a good afternoon and stay safe.